Diabetes affects millions of Americans every day. Now, some can control their diabetes with diet, while others need lots of medical intervention. Who is at risk and what can be done to treat it? Joining us this morning from Baptist Health is Dr. Devon Ballard from the Sherwood Family Medical Center. Thanks for coming in.
Thanks for having me.
You brought a whole pharmacy here, too.
I just raided the sample closets.
Obviously, there are lots of things, but first of all, let's talk about diabetes and what it is. We hear about it all the time.
Diabetes is something where it's really prevalent in the South for sure, in the United States, but South for sure, because we all like to eat down here.
And we like sweets.
And we like sweets.
Yeah.
But to truly diagnose it, usually people will go to a doctor or actually maybe go to somebody's house and do a glucometer and say, why is my sugar so high? But a lot of people have certain symptoms that are kind of classic, like excessive thirsty all the time,
right,
or urinating or peeing more than usual. Why are they peeing at night so much? And fatigue. And a lot of times we'll check lab parameters to see, is the sugars high or low? And to truly diagnose diabetes, you can do it multiple ways. If your sugar at any time is over 200, it's automatic.
Okay.
Or if you come into the clinic and we just do routine physical labs, any fasting blood sugar over 126 twice. Okay. So if we get one, we do it again. Yeah. And then that kind of confirms the diagnosis. But let's say the sugars are under 126 or 118 or 119, which are not normal but not diabetic. That's kind of a condition we kind of talked about before this, called impaired glucose tolerance, where it's a pre-diabetes, where it's showing the signs. We need to do a little bit better. Sometimes medicine, or just do better exercise and eating habits.
Is that when people say I'm borderline diabetic? Sort of the same thing.
It's actually we call it IGT, but it's a condition where, you know, kind of puts the lights on to say, hey, let's do some intervention, maybe nutrition and exercise, or the ADA diet, or American Diabetes Association diet. There's no sweet tea, no pies. And,
you were just talking about how much sugar is in the average sweet tea, and it's a lot.
Yes, 24 to 36 ounces of just sugar in each gallon.
So first you try to tell them to adjust their diet, maybe exercise a little more.
Yeah, there's no magic trick to it. Just eat better. Think about simple sugars. Sugar in your tea, syrup for your waffles and pancakes, things that have just what I call massive amounts of sugars in them. Sweet tea is another one. And just kind of modify what you're doing. Doesn't mean you have to, you know, it's all volume control. Doesn't mean you can have a piece of pie or cake, just smaller piece every once in a while, because you still got to live and eat well, but just kind of being disciplined, not getting the large piece of pie.
And then another piece for dinner, too.
Exactly.
Okay, talk about some of the medications that you've brought here.
There's a lot of times we try to do diet and exercise for sure. More than likely, most people have to be on multiple different medicines to try to help try one at a time. And there's medicines that help with get your sugars better. And the key of most diabetics are the sugars in your bloodstream. And the insulin that your pancreas makes is supposed to drive the sugar out of your bloodstream into cells so you can burn it. For some reason, a lot of people, the insulin is not working as well. And so we give some medicines to help the insulin receptor work better. Or if you're truly an insulin diabetic, doesn't matter what medicine you take at all, you have to have insulin. These won't do anything. And that we talk about the type 1 diabetic that either kids have or occasionally see with an adult new onset, you have to actually truly give insulin. There's no pill that will really help.
So there's a wide range of different effects it can have. Is it easier to test now? I know that you still have to prick your finger.
Yeah, when I actually write the glucometer for people, I just write glucometer, because there's 50 to 60 kinds at the pharmacy that you can use. But it's a small little poke, causes a little blood. It's not as bad as it used to be. Not everybody needs to check their sugars every day. If their sugars are relatively well controlled, you can check it twice daily, twice a week, unless you feel weird or bad. Then we say, let's check it a little early. So
a lot of options out there for you, but mainly be sure that your doctor is checking your sugar and your glucose when you go for your checkup.
Get your physical.
Get your physical. It should be on the list of things to do. Okay, remember the Baptist Health Line at 1-888-BAPTIST. There's the number for you, too, 227-8478, whether your question is about diabetes or really any health issue. Thank you, Dr. Ballard.
Thanks for having me again.
We appreciate it. No sweet tea today. Stay with a little lemon, a little sweet, right? Okay.